Good afternoon, everyone. Good afternoon, everyone. We'll get started in just a minute. We're going to wait for some folks to join our Community Connections meeting this afternoon. Again, for those who are just joining, we're waiting for folks to join our Zoom meeting. We'll get started here in just a minute. All right, good afternoon, everyone, again, and welcome to this Community Connections, part of our series, reaching out to answer questions for members of our community and our patients. Part of our commitment at Duke Health to caring for our patients and our community in this remarkable time as we're all managing through COVID-19. Our topic today is a Ask the Expert topic where we have some of our leaders and team members in children's health are here to help answer your questions and help you navigate issues that you may be facing about returning to in-person learning for your loved ones in the time of COVID-19. We're here to answer your questions on that topic, vaccinations, and on how to prepare your family for respiratory illness season, which is right around the corner. So as we start today, again, thank you for making the time for these important conversations, for trusting us to share some of our experience and recommendations with you. And we really wanted to start just to reinforce something that we've all certainly heard many times, but important to reinforce that knowing your W's, wearing a mask that covers your mouth and nose, waiting 6 feet apart and avoiding close contact, particularly when eating or unmasked, and washing your hands when possible or using hand sanitizer. Those 3 W's are our most important ways that we can stay safe and keep our family and loved ones safe. So really strongly encourage you to consider those. And in addition, I'll put my plug in for a flu vaccine, which I'm sure we'll hear more about from our panelists. It is the right time to be getting your flu vaccine to help keep you safe from influenza over the coming months. Now, again, we understand these are challenging times for families, especially those with young kids. And our team here is here to share some ideas and recommendations with you and answer your questions. And I'm really pleased to welcome 3 of our great colleagues here at Duke. First, we have Dr. Ebuka Akinboyo, who's one of our pediatric infectious disease specialists at Duke Children's Hospital and Health Center. Ebuka has played a really active role in our COVID response and has also been a leader here in our community, working with school districts and other community leaders as we think about how to manage children's health and wellness during COVID-19. In the middle, we have Dr. Kitty O'Hare, who's one of our internal medicine and pediatrics physicians who practices pediatrics at our Holly Springs location. And Dr. O'Hare has also been working, leading how we're going to manage access to care during our flu and respiratory season. I've been working with a lot of families, especially those with chronic conditions like asthma, diabetes, and autism in this time. And last but not least, on the left, Dr. Carolyn Avery, also trained in internal medicine and pediatrics, who works in one of our North Durham locations at the Duke Health Center on Roxborough Street. Dr. Carolyn is an active leader in our education programs and also caring for patients with primary care pediatrics and complex needs as well as young adults. So welcome to the 3 of you. Thank you so much for being here today. And with that, we're actually going to dive right in to some of the questions that had come in advance of today's session. So we'll just dive right in. I will remind everyone that you can submit questions live. You can do that through the Q&A function at the bottom of the Zoom screen, or you can email your questions to contactduh@duke.edu. So with that, perhaps I'll start with the questions in the order that we introduced you all. So Ebuka, perhaps I can start with you with a question that we got that I think many of us have, certainly one I've faced with my own daughter who's in high school. As school systems are transitioning to offer an in-person component for education, what are your recommendations about factors that families should consider when they're making that decision for the family? Should they send their child back? And if so, how can they keep them safe in that setting?
Thank you, Tom. Thank you for having me here today. As you know, we've spent weeks and months just trying to come up with a succinct answer to that, but I will try and summarize try and address some of the nuances people have to consider. I've been personally impressed by the school district's leadership dedication to having a set protocol and ensuring as a parent or caregiver, you've either reviewed or you have access to ongoing protocol that includes COVID-19 restrictions and what to do if your child is exposed or if your child is ill, and what the screening processes are to get your child to school for in-person education would be important. I think you already addressed one of the key factors to successful in-person education, and it does have to do with all of us playing a part, even outside of school. It involves wearing a mask, washing our hands, I'll put in getting a flu shot, and also certainly waiting at least 6 feet from those that are not in your household. For school prep, the only other specific would be ironing out with the risk factors that may be unique to your household, in case you have to factor that into your decision for when and how to go to school. We also have ABC Science Collaborative that's helping schools just interpret and work with NCDHHS, North Carolina's Department of Health and Human Services guidance, which have incorporated a lot of the CDC recommendations to have plans. So lots of different ways to get ready, know the protocol, review it with your child, review it with the school leadership, and ensure that you have your own plan in place for potential exposures or any illness.
Thank you, Rukin. I know these have been really difficult answers to formulate. Thank you for sharing that and for all that you've done. Kitty, I'm moving to you. A number of folks participating have asked questions about if my child's in virtual school, should I limit the amount of time I allow for additional screen time for enjoyment, other activities, video games, television, movies? What's your advice to parents about that?
Thanks, Tom. That's a great question, and it is great to be with this panel today. You know, prior to COVID, we talked to parents a lot about screen time and the need to be thoughtful about screen time. And now we have this new world where school is online, and online is now also how we make our social connections. So at this point in time, because we are trying to be thoughtful of each other, of our community and our family members at risk, connecting virtually via screens can be a way of staying in touch with your friends, your relatives. So I'm encouraging families to relax some of their earlier thoughts about screen time, but also to keep in mind that we still need active play in our day. We need time for exercise, time for imaginative play, and connecting with our families at home.
Thank you, Kitty. I'm seeing additional questions coming in with similar questions about that, maybe just as that really that you hit on there around combating loneliness and social isolation, particularly for this question was about elementary school students, but really across age groups. Perhaps I'll turn to Carolyn and ask a question about that. What is your advice to families about those issues of isolation and a disconnect? How can parents, what are some options or advice you've offered to parents about that?
Yeah, definitely a widespread problem we're seeing with all of our families, both parents and children kind of suffering from similar problems. And definitely we're seeing a lot of underlying mental health problems or anxiety problems and things that may already have existed as well. So I definitely echo what Kitty said in terms of, you know, screens have good sides and bad sides, and we do appreciate their educational value and their connection right now, but also not shying away from other ways of connecting. You know, we talk about outdoors activities, being safe, particularly if you're distanced and masked. And so particularly for elementary school kids, now that we're in luckily a phase in North Carolina where playgrounds are open, there are lots of families doing outdoor play dates. So again, all children over 2, we definitely encourage mask wearing, and children over 2 can safely and easily wear masks with the proper education and encouragement from their adult caregivers. And we really do consider those low risk activities for getting together. So kind of being creative and thinking of things to do. I know we'll talk more about holidays, but going into holiday time, you know, what are creative things and innovative ways that we can kind of still celebrate And some might be online and some might be, outdoors.
Thank you, Carolyn. That's a great answer again for a difficult question. Just continuing with some of the online questions that are coming in, boy, there's a lot of really good ones. Abuken, back to you. We have several folks on the call today who've asked questions about whether we expect there'll be additional tests that are available for pediatric populations, additional rapid tests or point of care tests that will be more widely available for pediatric patients.
Yeah, that's a great question. I will say within the Duke system, we do have rapid point of care. I think that's what they're addressing. Point of care tests that have been used for pediatric patients in some settings. Taking that outside of the Duke system and thinking through the utility in schools, I think having access to testing within the community should probably be more emphasized than having a test module, having the ability to test on the school's premises. I think the schools are doing a lot of work to ensure that if someone is symptomatic or exposed, they don't have to come on campus to be educated. They can jump into virtual learning. And we've all done a lot of work to ensure that the way in which you get tested and sites that allow for pediatric testing are publicly available. And also, of course, a lot of credit to our local public health departments for this. I also expect that in the coming months, we will see easier testing processes. So we may not have to stick a swab up everyone's nose, particularly the younger kids. Some people are doing a lot of work on saliva testing, and this is ID week. We have a national conference where people are presenting about being able to breathe into an instrument to test for COVID-19. Of course, time will tell how successful these testing modalities are in picking up the infection, but I'm eager and looking forward to seeing easier access to testing as we move into the next few months.
Thank you so much. Again, several folks have been asking that question, and I appreciate the plug putting. I know that Duke, UNC, and the local systems do have a pretty good access for testing now with a good turnaround time, and hopefully that'll make it easier when children or family members do have symptoms. And that kind of leads in perhaps to the next question as we head into this respiratory season where there's lots of coughs and colds going around. Since we know that the symptoms of COVID-19 can look identical to common cold and flu, several people have asked the question, when should I get my child tested for COVID-19? And I guess maybe I'll start with one of our primary care pediatricians, maybe Kitty, ask you if you want to answer that, and then ask Abuken and Carolyn to weigh in as well if they have any other advice on that.
Sure. In the old days, the pre-COVID days, often families would call in to their primary care pediatrician and say, hey, my child has a little bit of a runny nose, a little bit of a cough. Can you just write a note so that we can go back to school, get back to daycare, go on with our lives? Well, now, as you said, Tom, all of the symptoms that could be the common cold could also be COVID. So in primary care, we're being a lot more thoughtful about keeping the patient safe, but also keeping our community safe. So we're not doing those reflexive notes back to school without talking with the families and evaluating the kids. Decision to be tested or not, I think a lot of that is a shared decision making with the families about what makes sense in their home situation. Counseling families about if you don't get tested, here's the period of time that you should stay home, keep the child isolated from the community just until they're past any possible chance of spreading the disease if they have it, versus getting some testing done, maybe finding out that the symptoms aren't COVID, maybe there's something else. And if we're COVID free and symptoms are improving, being able to get back to school a little bit sooner. So the decision to test or not, a lot of times does depend on families and where they are with their lives and how sick the child looks.
Thank you. Similar question, there's some questions about young children under age 2 and infants in terms of thoughts about daycare. And again, I think a similar question about any specific symptoms to look for COVID in those very young children that we know can't really tell us their symptoms. I don't know,
Would you
Carolyn,
like me to take that?
Sure, Abuken, thank you.
I'm more than happy to. So I think just the tail end of jumping on what Dr. O'Hara was mentioning there, some schools do have protocols around testing if a child is exposed. And I think it's important to defer and use those. And again, we're lucky to be in a state that received an A+ grading for their COVID-19 tracking and guidance. So we have a lot of specific guidance about when and how to test someone that's exposed and symptomatic. And that takes me to discussing symptoms, which we know can be relatively mild in our younger kids, particularly infants. To be clear, kids can get sick, they can get infections, and they can spread it. However, they do tend to be a little bit milder or sometimes asymptomatic if they're in a household with others that have COVID-19. And so that pattern is somewhat reassuring, but I think we're all in the boat of trying to reduce infections or eliminate it amongst our kids. To test an infant, I think every mild symptom right now probably would default to a COVID testing pathway. It's really hard to separate it out because a mild runny nose could be associated with COVID-19. And I think that's probably fine. I don't think we've reached the over-testing category yet. If we do, we can then readdress our strategy. If a child is exposed, so if they're in a household where multiple household members, such as the adults in the house, have confirmed COVID testing, it is reasonable to test a child in that household, even if they're asymptomatic.
Thanks, Abukin. Really appreciate that. Yeah, Carolyn, another question that's come in that we actually had both before and during the session today from people wondering about whether they should postpone well child care or regular scheduled immunizations or vaccinations, either any concerns about, I guess, coming in and being exposed while getting care, or just any concerns about specific issues at this time during COVID of getting well child care.
Yeah, great question. I think we've definitely seen, a national trend across our country of decreasing rates for well visits, both in kids and adults, and vaccines. And this has definitely been concerning for us, in primary care pediatrics. I think to address the first part, just safety in our clinics, I think, across all of Duke Health, we really feel like we are keeping our patients and our staff, as safe as humanly possible right now. There are many added protections that you've seen on websites and from, our calls to you about waiting rooms kind of being deferred, check-ins by car, distancing, everyone wearing masks, and in our case, eye protection as well, and really trying to space out and make you as safe as possible. So, I am the medical director here, and I do always give my stamp of approval when people come in. I brought my own kids in, 3 months ago for their well visits. And I think the other side of it is, well visits kind of assume that the person is well. And so if, they're not feeling sick, why come? And I think particularly in pediatrics, there are a lot of things that kind of go on almost behind the scenes during well visits. There's a lot around monitoring of growth and development, a lot of screening that we do that does sometimes pick up on things that might not otherwise have been identified. Along with that right now, we're seeing such a tremendous increase in difficulties obtaining food, trouble with rent and utilities, and a lot of those social drivers of health that we're also very aware of and screen for, and are really asking all of our families, because we're very closely tied with our community and the resources available. And we might know of something that, families otherwise wouldn't have heard of. And so that's another big part. And I alluded to some of kind of the mental health things that we've seen a lot as well in primary care, particularly, teenagers with isolation. We're seeing depression, young school age kids having trouble sleeping, or behavioral outbursts that are really kind of underlying anxiety or worries. So a lot of those things that might have gone unnoticed or untreated, we'd really love to see people and help families with.
Thank you, Karen. And just to build on that, maybe ask three of you if you have any additional comments. Several parents have written in asking for what should they be looking for in terms of that additional stress due to COVID, warning signs, or since you mentioned a couple there, Carolyn, about difficulty sleeping and changes in behavior, but other advice for parents about things they should be looking out for, to watch for, and any additional strategies they can deploy to help combat some of that stress and the negative mental effects that many of our children and families are seeing.
Yeah, I'll just expand and then defer to Kitty and Ibukin if they have other thoughts. I think, parents know their kids best. And if you see, any differences in their routine, the way they respond to appetite, sleep, we were mentioning, kids are hyper aware of what's going on around them, even if it's not talked about. And I think actually more so when it's not talked about, because then they worry. So also just being so open and honest, I think, during this pandemic with them about what your own worries might be, you know, to some degree, what the things we're doing to keep them and their families safe. You know, I know at my own, I have a 4-year-old and a 2-year-old, and there was a day I came home and my 4-year-old was very concerned about me going to work. And, you know, she asked, "Are you going to die when you go to work, mommy?" Never would have thought that would have come out of her mouth, but she had obviously picked up on that. So kids very young, you know, are aware of what's going on. And so I think, you know, having those conversations in the same way we talk about heroes wearing masks, and that they're a hero too, in a lot of the things they do, you know, ways to combat that. So short of just talking about it and being open as a family, there are lots of great books out there right now to help have that conversation with kids, specifically around COVID, but also around things like Black Lives Matter and all the other things that are going on right now that they have questions about. So lots of online resources and podcasts for parents about that. And then again, your pediatrician is always a resource as well for connections to community resources or mental health resources. There are lots of great meditation and kind of anti-worrying activities and games for younger kids too.
Thank you, Carolyn.
Carolyn just said. The American Academy of Pediatrics website for parents, healthychildren.org, is another place to go with great resources about how to talk to your children about COVID-19 and think about stress. Also to mention, Carolyn referenced change in appetite as a behavior that can be impacted by COVID. And along with everything else, we are seeing both an increase in obesity as well as an increase in disordered eating, especially with teens trying to take control over life and their bodies by restricting how much they're eating. And those are situations that by coming into a well visit, we can help identify those with you, and we can partner with you to find resources.
Thank you. Abuken, I'm going to turn back to you with a question that's come up about COVID vaccination, and a question from a couple of families about should we expect COVID vaccines available for children, or when should we expect COVID vaccines to be available for children?
It may be hard to answer objectively, but I think if we base the pattern of what happens with vaccine trials, we know that the UK has a trial that now incorporates children, at least the older children, about up to age 16. And now the US is considering, I think we've had at least one company that got approval to include children as down to age 12. So just to answer the first question, children had not been previously included in vaccine trials to date in the United States. And so we need to have some trials dedicated to children. Remember, we don't restart the entire process. So we learn from the trials that occurred in adults, and that moves the timeline for pediatric trials in children, and may lead to a faster process for approving the vaccine. The goals remain the same. This will be a safe, effective vaccine. I think otherwise it wouldn't get approved. And the other part to this is for everyone to understand the process that's being sped up is really the production and distribution paths that usually take years to develop. The safety and efficacy of the vaccine is not there's another parts that are in question or being sped up unnecessarily or unsafely. So what's the timeline going to be? I think most of us are optimistically expecting mid to late 2021 for a vaccine on the market, and that may address children middle school to high school age. Younger children, it may go into 2022, but I could be wrong. We've seen a lot of surprises this year, good surprises, some not so good. So potentially it may be sooner, but because we don't have an adult vaccine yet, I think I can only optimistically hope for mid to late 2021.
Thank you. So again, just reinforcing that vaccines, one of the ways that we can protect against infection like COVID, means we need to keep focusing on those other things, on our 3 Ws and on the things that right now we do have available as we wait for that vaccine for adults and children. So I really appreciate your focus on the need for it to be proven in children and safe and effective as well. Let me go back here. I think we have time for probably 1 or 2 more questions. And there's one here that we didn't really tackle. A couple folks asked questions about that, you know, there's extra precautions for adults with chronic diseases like autoimmune disease or diabetes. For parents of children with chronic diseases, autoimmune disease, diabetes are 2 that were specifically raised. What are your recommendations in terms of how to keep them safe? Should they follow the same return to school guidelines or others, or should we think about these children differently? Anyone want to dive in on that one?
I can start off, and certainly my colleagues can also weigh in. I think I focus on the data and what the data suggests. We expected that we may see worse outcomes in children with altered or just concerning immune systems. And that could mean a number of things. Most of us would think more of kids that have cancer, but we know that some of the risk factors we've seen for worse disease include things like heart and lung disease. What's been encouraging is some of our more common illnesses, so something like asthma has not been directly associated with severe outcomes. And I think that means a lot of kids can return, when it's safe, can return to in-person education if that's an option that the family has chosen, or can at least continue with the safety practices that the family is doing to prevent infection across the board. I think for some kids, so someone had mentioned autoimmune disorders where we may not even know enough. Creating that bubble effect, so knowing that the 3 W's work for preventing infection and continuing those. I will say, just practically speaking, I have spoken one-on-one with some of my patients and their families, and we've seen a number of kids, even with complex histories, return to in-person school over the past couple of weeks and have done so safely. And again, we're waiting for more data, but it does suggest that our kids are surprising us and they may be okay, but it should be a joint decision making with you and your provider as you walk through what exactly the situation should be to protect your child.
Thank you.
Yeah, I was just going to add, I think we all hesitated because there's not been great data in pediatrics about comorbidities. And a lot of it is extrapolated from adult data. And even the adult data, I'll say, was somewhat theoretical in the beginning. It was a lot of thinking about how COVID works and what those possible comorbid, chronic diseases might be. I was just going to echo Ibakin. I think the one we heard a lot of families concerned about was kids with asthma or parents with asthma. And that really, if anything, almost seems like it might be the reverse, that kids with asthma or allergies might actually have better outcomes in some recent studies. So I think the jury's still out on a lot of them. But again, the good news is kids in general are rarely hospitalized. And, for those who are infected are asymptomatic or mild, including kids with some more chronic diseases. So time will tell, but I definitely agree with Ibakin. We've been counseling people that, with the right precautions, we do think the vast majority of kids, even with chronic diseases, could go back to things like in-person learning.
And many children with chronic conditions get specialized therapies through school that have been hard to replicate virtually. So as Carolyn and Buchan said, not a lot of data, but what we have seems reassuring that we can get some kids back into the classroom, back to a place where they can receive their in-person learning plans and therapies in a safe way.
That's a really good point as well to add. Thank you. Well, we are just about at time, everybody, but I think I'll give each of our panelists, first off, thank you again for your time and expertise and sharing that with everyone today. But open it up if each of you wanted to offer any last piece of advice. We didn't really tackle the holidays and Halloween. If anyone wants to offer any advice about that topic or anything else here in our last 2 minutes. Kitty, maybe we'll start with you.
I'll raise my hand for Halloween. One of my favorite holidays. My costume is arriving in the mail today. Halloween, it will be wonderful. It will just feel a little bit different this year. The website I referenced earlier, healthychildren.org, has some great tips for celebrating Halloween safely. A couple of tips for parents to remember. One is that still, if you're outside, if you're around other people, you need that regular face mask that we've been using at all times. A plastic costume face mask is not going to protect you from COVID. So still use your face mask. Consider activities where you could be socially distant, greater than 6 feet apart, a virtual costume parade, a virtual Halloween party, an outdoor movie, lots of scary movies outside, decorating pumpkins. So there's a lot that we can do to celebrate the season, just in a safe way.
That's great advice. Carolyn, any final words of wisdom for our audience?
Yeah, I hate to end on a down note, but I do want people to be aware that in thinking about the symptoms of COVID, particularly in kids, what we hear a lot from families is a little bit of COVID denial and thinking that, my kid with just a runny nose or this mild cough, it's probably seasonal allergies or asthma acting up. And a lot of them do test positive for COVID. So really do tell us about them. We love to test. We really are encouraging testing even for mild symptoms to try to control this disease and our community prevalence. So please be vigilant and not ignore symptoms too.
Thank you, Carolyn. Anna Buchan?
Just one last thing. I agree with everything everyone just said. We've been in this for a lot longer than all of us anticipated. We're all tired, and I think just buckling down, knowing that the only way out is continuing to do what we know works, which includes masking, washing hands, and as much as possible, even while celebrating holidays. I know some of the celebrations occur indoors, encouraging people to quarantine when they can to limit other events if you're going to have something indoors, and ensure everyone is masked and spaced out if you can. But limiting indoor events, even as it gets colder, is probably a good idea.
Well, thank you so much. And again, thanks to the three of you for sharing your time and expertise with us today. Thanks to all of our community members and patients who've joined us for this session today. We will post answers to these questions and answer some of the additional questions that have come in and make that information available to everyone. So again, on behalf of Duke and Duke Health, thank you all for your time today. And please stay safe, and I hope everyone has a great evening. Bye-bye.